Welcome to this session today where we're going to talk about some of the highlights from the 6th World Symposium on Pulmonary Hypertension. Today we're going to talk a bit about genetics, and in specific, why is it important to test patients for genetic mutations that can lead to the development of pulmonary arterial hypertension? Well, as you may know, a significant proportion of patients with pulmonary arterial hypertension are heritable, and many of them have a genetic mutation. So one reason to perform genetic testing is to confirm that diagnosis, and it helps us avoid additional diagnostic testing. It might help us refine the prognosis. We know that some genetic markers carry a poorer prognosis and a higher rate of mortality or need for lung transplantation. So that might help the physician refine the prognosis and discuss that with the patient. It might help us learn more about future molecularly based treatments. Someday we hope to get to the point where we can personalize medicine, and if we know a genetic marker, maybe we can specifically target that. It is also helpful to risk stratify family members, and it's really important to include genetic counseling in addition to genetic testing. So if a patient has been identified as having a mutation, one might feel that it's important to inform their other family members, and potentially this would facilitate earlier diagnosis for family members. It also might inform reproductive options. If someone of childbearing potential, or a man who is thinking about a family as well, has a gene, it might be very useful for them in terms of planning a family and maybe even pre-implantation genetic testing. And it also can help address some patient concerns. Sometimes patients ask, why did I get this? And it's helpful to know whether or not it was genetic. There are many resources to assist with genetic testing. It's very important to take an excellent family history, and there are paper screening tools that you can use, and there are also resources available online from the government. Familyhistory.hhs.gov is one in particular. There are educational materials. It's very important for the patients to understand the implications of genetic testing, and listed on this slide are a number of educational materials that might be shared with patients. There are certainly registries of genetic testing, and it's also important that the patients know that there are multiple ways of obtaining biological samples, not just the blood, but also saliva and buccal swabs as well. And it's very important for the patients to have genetic counseling, specifically by genetic counselors who are familiar with the disease and the implications of certain genes. And sometimes that can be performed by telemedicine or video conference, because not all facilities have such resources. And the genetic counseling is important not just for the patient, but also for unaffected family members. They have to make decisions about whether or not they want to get tested as well if there is the identification of a genetic abnormality in a first-degree family member. This is one of the sections that I personally found most helpful and changed my practice the most after the World Symposium. It was the discussion about genetic testing, about the new genes that have been identified, about the availability of these tests commercially, and we have started to apply this in our practice, genetic testing for Group 1 patients. Well, certainly patients with a positive family history should be offered genetic testing. If we can find the gene in them, we can then screen the rest of their family if they're interested. But I think it's also important to offer genetic testing to patients with idiopathic pulmonary arterial hypertension, because a substantial proportion of them may have a genetic mutation, particularly the BMPR2 mutation. And that can be because of either a spontaneous mutation, or it can be because the family history is so difficult to take. The BMPR2 mutation is notorious for having incomplete penetrance, so not everyone who has the gene develops the disease, and so it may be hard to take a family history. You can also offer it to patients who have what you thought was drug and toxin-induced pulmonary arterial hypertension. There is a new gene that's been associated with PVOD and PCH, and it's important to offer testing to children, particularly because the genetic abnormalities portend such a worse prognosis. This slide reviews some of the comparison of genetic testing results between adults and children. So the top two circles are patients who are known to have familial or heritable pulmonary arterial hypertension. And you can see on the left in the adults, about 70% of them are the BMPR2 mutation, a smattering of other mutations, and again, a small percentage, about 20%, in whom no mutation is found. And that is possibly a patient who has a mutation that we haven't yet identified. And in the pediatric population, those less than 18, the most common mutation, again, is the BMPR2 receptor mutation. And again, a quarter of the patients do not have any mutation found. On the bottom, you see the patients who were thought to have idiopathic pulmonary arterial hypertension. And on the bottom left, you see in the adults, the majority of patients don't have a mutation, but about a quarter of them do. And in children, a little bit more than that have a mutation. And those were patients who were thought to be just idiopathic pulmonary arterial hypertension. Well, we're very lucky now to have panel gene testing that gives full coverage sequencing and deletions, which are important for a number of the genetic variables that we have identified. This can test for all the genes known to cause PAH at this time. It takes a little while, it takes about 4 to 8 weeks, and it needs to be sent to a special lab that has certification in this. So it certainly makes it a little bit easier for the patients. So that was a summary of the genetic testing discussion that occurred at the World Symposium. Again, something I think was very important and translates well into the clinic. And in my clinic, we have started being much more aggressive about genetic testing based on the information that was shared at the World Symposium. So thank you for joining.